I am going to be reading directly from the FDA briefing document, so I'm crossing my fingers that YouTube will continue to allow this video out there because I'm not making this up. I'm going straight to the FDA, but again, I will be honest, as I've said in previous streams, this topic, when it comes to COVID, is one of those community guideline topics where you're not always totally sure what YouTube's going to allow or not allow. Real fast, thanks, Saland. Am I saying your name right? $2 super chat. I appreciate it. So, guys, what I wanted to talk about today, kind of what prompted this, is obviously we all know that the vaccinations are underway. And if you read most of mainstream media, they say typically the same thing: safe, effective, and of course, I'm sure if you've been paying attention, even the New York Times has been reporting there have been some adverse reactions by healthcare workers. The UK put out a warning about people who have prior history of allergic reactions, to be careful with this because some folks are having, these sort of respiratory issues after getting the vaccine. They have to be hospitalized. And I will say that so far it seems to be a small amount of people, but that warning did come out in the UK. We did just see some healthcare workers in Alaska were cited with that kind of reaction. And this video is not specifically, I didn't want to really get into the safety stuff, that side of it, because frankly, it's still kind of coming out as these vaccines are being rolled out. And I think that's one of the things that I want to talk about is the unknowns that we are sure we don't know about. So in other words, like, there are possibilities that people will have reactions to these vaccines. We're going to see them, and the news is reporting on those as they happen that we've seen. But I wanted to show you what is in the actual FDA briefing documents about Moderna and Pfizer's vaccines as unknowns about efficacy specifically, because I want to make sure everybody is educated on, if you decide to get the vaccine, which if you decide to do so, that's your choice. On this video is not about whether you should or shouldn't get the vaccine. I want you to know what we know is the benefit, I guess, that the drug companies themselves are sure about, and what they don't know about, so that you at least know, like, hey, if I'm going to take the potential risks of getting the vaccine, these are the things that they say they know that it will help me with. Because we all in life, no matter whether it's a vaccine for COVID or getting in the car and driving, we're all every day outweighing, risk versus reward. That's what life's kind of about, I guess, sometimes, right? So what's the reward? What do we know about the rewards? Can we take a look at that? What does the data show? What are the drug companies saying? So that you want to take the risk. Here's the potential reward. Maybe for some people it's worth it. Maybe for other people, no. Let's see. Let me just get to some of the comments here. Lee, thanks for the super chat. Keep up the great work, Miss Morrow. I really appreciate it. Kuvan, thanks for the super chat. So let me show you the news article that got me thinking about doing this topic. All right. So this is from NBC News. Let's see, December 20th. Recent, obviously. And it's titled, "Fauci Tells Kids Not to Worry. He Gave Santa Claus the COVID-19 Vaccine. The world's most famed gift giver will be safe to travel on Christmas Eve after a house call from Dr. Anthony Fauci." I gotta say, like, maybe I'm just being the Scrooge here, all right? Or the Grinch. But this article, to me, was like straight propaganda. I'm just gonna go out and say that. And watching some of the coverage of this, kids town hall that CNN did, I was just like, man, because the things they're saying, if you read the FDA documents, they don't know to be true. So besides the fact that you're using Santa Claus as sort of the nice, in way to sell this. And again, I'm not doing this video to say you should or shouldn't get the vaccine. But I want to be factual with people about what the drug companies themselves are promising, okay? So that, let's just say we all agree Santa Claus actually exists. My daughter is in the other room, and she's too young to even know anyway. But if Santa Claus were vaccinated and he was asymptomatic, would he be able to transmit the virus? If he, he did go around and deliver his presents, what does Pfizer or Moderna say about that? Well, it turns out actually that Santa Claus probably could still give you COVID, well, the SARS-CoV-2, and then whether you develop the disease is obviously, we can go through the risk factors depending on age and pre-existing condition and whatnot. That's a video for another day. But whether he could transmit the virus, according to the drug companies, yes. Okay. Well, or I should say this. He could. Yeah, he could transmit it because they don't know. They don't know if you get the vaccine and you're asymptomatic. If you have the virus, if the virus is in your, you have it in your nose or something, if you can transmit it, they don't know. So to say that Santa's safe and all this stuff, that was the first thing I was like, all right, come on, guys. Because look at this. It's like, will Santa still be able to visit me in coronavirus this season? 6-year-old Paxton from Illinois asked. What if he can't go to anyone's house or near his reindeer? And this was Fauci's response. I took a trip up there to the North Pole. I went there and I vaccinated Santa Claus myself. I measured his level of immunity and he is good to go. Santa Claus is good to go. Okay, so like, wow, we're laying it on thick here. So let's see. What do you guys think about that first? I'm just curious. Let's see. Santa's beard is a huge reservoir for disease and pathogens. That's hilarious. Don't tell my husband that. He has a huge beard. Let's see here. The elves would all have to be vaccinated too. True. So, okay. Let's see here. So we want to see the FDA documents, right? That's what this is all about, because don't trust me. Trust these briefing documents, I guess, if you want to. They were presented by Pfizer and Moderna, so you can decide whether you want to trust them. But hang on, let me pull this up here, okay? So the links to these documents are in the description. You can check them out for yourself if you want to. I have an Acrobat Reader document I'm going to pull up in a second, but you're not going to be able to see it because my software is not going to, but I'm going to scroll down to the page here so you can at least see, but it's going to be kind of small for you to read if you're interested. So this is Pfizer's, and we're going to go to page 46, I believe. So stand by here. Let's just scroll down. And we're going to go to the safety and efficacy portion of this. Okay. Again, YouTube, if you are manually reviewing my content, this is coming from the FDA. All right. This is not Allison making this up. So let's see here. All right. Yeah. Page 46. Benefit risk assessment in the context of proposed indication and use under EUA. Known benefits, and then it has unknown benefits data gaps. And, you can scroll down here and see everything from effectiveness in individuals previously infected, effectiveness in pediatric populations. And I am going to just check out my version of this, which again, like I said, I have it big words here and highlighted so that I can get you this quickly and you don't have to watch me scroll through a bunch of it. So this is, again, we're looking at Pfizer first. Effectiveness in certain populations at high risk of severe COVID-19. Okay, so it says, although the proportion of participants at high risk of severe COVID-19 is adequate for the overall evaluation of safety in the available follow-up period, the subset of certain groups, such as immunocompromised individuals, is too small to evaluate efficacy outcomes. So the first group where efficacy is unknown is immunocompromised individuals, e.g. those with HIV/AIDS, for instance. Second, effectiveness in individuals previously infected with SARS-CoV-2. Available data are insufficient to make conclusions about benefit in individuals with prior SARS-CoV-2 infection. Now they'll say, however, available data, while limited, do suggest that previously infected individuals can be at risk of COVID-19 reinfection and could benefit from vaccination, but they do say it's insufficient data to make conclusions about the benefit. Effectiveness in pediatric populations. No efficacy data are available from participants ages 15 years and younger. Although adolescents 16 to 17 years of age were included in the overall efficacy analysis, only one confirmed COVID-19 case was reported in this age group. Future vaccine effectiveness is influenced by characteristics of the pandemic, changes in the virus, and or potential effects of co-infections. So this says the study enrollment and follow-up occurred during the period of July 27 to November 14. So just a few months, right? We all know that. We know that this has been a fast rollout, right? It's called Operation Warp Speed, for God's sake. So we know that, we know this is fast for a vaccine development. So that shouldn't surprise anybody. So what they're saying is the evolution of the pandemic characteristics such as increased attack rates, increased exposure of subpopulations, as well as potential changes in the virus infectivity, antigenically, significant mutations to the S protein, and or the effect of co-infections may potentially limit the generalizability of the efficacy conclusions over time. Continued evaluation of vaccine effectiveness following issuance of an EUA and or licensure will be critical to address these uncertainties. Okay, so they're basically saying that, our studies happen quickly, so the generalizations we're making about these vaccines and their effectiveness could change depending on the characteristics of the population, as well as mutations to the S protein in, the virus, blah, blah, blah. Vaccine effectiveness against asymptomatic infection. Data are limited to assess the effect of the vaccine against asymptomatic infection as measured by detection of the virus and or detection of antibodies against non-vaccine antigens that would indicate infection rather than an immune response induced by the vaccine. Vaccine effectiveness against long-term effects of COVID-19 disease. So, of course, you've heard, for instance, that some people are called long haulers. I think that's what they're calling them. Basically, they get over the initial, disease, and then they have these long-term problems with organs, for instance, tasting, smelling. We've heard about that. And so for that, it says COVID-19 disease may have long-term effects on certain organs, and at present, it is not possible to assess whether the vaccine will have an impact on specific long-term sequelae of COVID-19 disease in individuals who are infected despite vaccination. So that shouldn't surprise anybody either, obviously, because we just don't have the longevity of research to know whether or not that's going to help. Vaccine effectiveness against mortality. Here's an interesting one. How does it affect mortality? A larger number of individuals at high risk of COVID-19 and higher attack rates would be needed to confirm efficacy of the vaccine against mortality. Vaccine effectiveness against transmission of SARS-CoV-2. This is another important one. Remember, because if Santa's going to come to your house and he gets the vaccine, can you hug him? Or do you need to wear your mask and socially distance? That's the big question. Data are limited to assess the effect of the vaccine against transmission of SARS-CoV-2 from individuals who are infected despite vaccination. It is possible that if efficacy against asymptomatic infection were lower than efficacy against symptomatic infection, asymptomatic cases in combination with reduced mask wearing and social distancing could result in significant continued transmission. So if I'm reading this right, it sounds like, if you have a lot more asymptomatic infection and it doesn't necessarily stop you from transmitting, and then people think, okay, well, we don't have to worry about this anymore. They're saying then you could end up having more transmission because, you get rid of your social distancing rules or your mask wearing or whatever else. That's their read here. Additional evaluations, including data from clinical trials and from vaccine use post-authorization, will be needed to assess the effect of the vaccine in preventing virus shedding and transmission, in particular in individuals with asymptomatic infection, like Santa Claus, I guess. This is not new. You probably have heard that part of it. I've seen Dr. Fauci on CNN and other places talking specifically about how we just don't know if you get the vaccine, if you can still transmit to somebody else. So that's not like a secret or anything. I've heard him say that. So let's go back to, I'm going to read a couple, let's see where we are here, right? With everybody's comments. Sure, it's interesting in here. Solan, thank you for the super chat. There are buttons on the bottom right of the PDF window that lets you zoom the file. Oh, yes, you can do that. For me, though, it's easier because I could highlight on the Adobe Acrobat Reader version of it, and I have a hard time keeping the highlight on just the web version. So that's why I'm reading from that. But you can do that. And I do encourage you to read these documents because it's right there in front of you. And why not use your right as an American to read what your government is working on. As a journalist, it was one of the best things about being a reporter in the United States of America was that you could file public records requests. Let's see here. Let's see, we got anybody else? Anybody else here? We can answer some questions here. Mrs. Santa. He's the only kid watching CNN. They had a lot of kids read in questions and for Dr. Fauci, and oh gosh, and the way the reporters handle them, sometimes I just wonder, like, I know these questions are out there. I know that they're capable of asking these, but why they're not, I don't totally know. Let's see. Jeff says, still no notifications of anything but YouTube and comment notifications. At least I can go watch it from the beginning when you're done. So it's not letting people know. I don't know. Did you guys get obviously some people got a notification that I was live because you guys are here. So, all right, let's go back to Moderna. Okay? Because it's basically the same, but you might as well see it for yourself. Why not? All right. So here we go. FDA briefing document, Moderna COVID-19 vaccine, December 17, 2020. This, again, I believe is around page 46. They're very similar documents. I'm just going to double check here, make sure that I'm on there just to make sure. Yeah, let's see. Yep. Okay. So page 48 for Moderna, benefit risk assessment in the context. So I'll just scroll down here. And you know what? I'm going to make them bigger for you guys, but I'm still going to read from my Adobe. So hang on a second. Let's see here. 48. Okay. Here we go. All right. So good idea to scroll in. That was a good idea, even though I'm going to still read from mine because I have mine highlighted. But here's the beginning of it, okay? Here are the data gaps. You can see right here. Duration of protection, for instance, as the interim and final analyses have a limited length of follow-up, it is not possible to assess sustained efficacy over a period longer than 2 months, okay? So is the vaccine going to work after 2 months? We don't know. Effectiveness in certain populations at high risk of severe COVID-19, same as Pfizer. Although the proportion of participants at high risk of severe COVID-19 is adequate for the overall evaluation of safety in the available follow-up period, the subsets of certain groups, such as immunocompromised individuals, e.g. those with HIV/AIDS, are too small to evaluate efficacy outcomes. All right, you see effectiveness in individuals previously infected with SARS-CoV-2. Limited data suggests that individuals with prior SARS-CoV-2 infection can be at risk of COVID-19 reinfection and may benefit from the vaccination. Regarding the benefit of the mRNA 1273 for individuals with prior infection with SARS-CoV-2, participants with a known history of SARS-CoV-2 infection were excluded from the phase 3 study. There was only one case of COVID-19 among study participants with positive SARS-CoV-2 infection status at baseline. Thus, the study was not designed to assess the benefit in individuals with prior SARS-CoV-2 infection. Efficacy or effectiveness in pediatric populations. No efficacy data are available from participants ages 17 years and younger. All right, so here I'm going to leave these up on the screen so you guys can check that out here. I'm going to go back to my Adobe just to look at my highlights here. All right, so future vaccine effectiveness is influenced by characteristics of the pandemic. Again, if things change with the pandemic, if the virus mutates, what will happen? Basically, they say the same thing as Pfizer, that they don't know what the generalizability and efficacy conclusions will be over time. Vaccine effectiveness against asymptomatic infection. It says data are limited to assess the effect of the vaccine in preventing asymptomatic infection. Vaccine effectiveness against long-term effects of COVID-19 disease. COVID-19 disease may have long-term effects on certain organs, and at present, it is not possible to assess whether the vaccine will have an impact on specific long-term sequelae, if I'm saying that right, sequelae of COVID-19 disease in individuals who are infected despite vaccination. Additional evaluations will be needed to assess the effect of the vaccine in preventing long-term effects of COVID-19. Vaccine effectiveness against mortality. A larger number of individuals at high risk of COVID-19 and higher attack rates would be needed to confirm efficacy of the vaccine against mortality. Benefits in preventing death should be evaluated in large observational studies following authorization. So that's, to me, that's big. That you need to do more study to see the efficacy of the vaccine against mortality. Data are limited. This is for vaccine effectiveness against transmission of SARS-CoV-2. Data are limited to assess the effect of the vaccine against transmission of SARS-CoV-2 from individuals who are infected despite vaccination. So there you go. And again, as I said, that was something that I've seen Fauci say before, so not totally shocking there. That we would see that transmission is one of those unknowns. Now, here's Vaccines and Related Biological Products Committee, December 10th meeting presentation. This is for Pfizer. One thing I thought that was interesting on this one, if you scroll down here too, and I believe, so this is again for benefit risk and then future ongoing studies, okay? I'm gonna, let's see here. I'm gonna leave this page up here. And actually, you know what? Let's see here. All right. This is benefit risk assessment in context. Again, for what you see, and also, which is interesting here, is that SAEs possibly related to vaccination, shoulder injury, and then, increased activity of your lymph nodes, basically. But the data are limited from adolescents 16 and 17 years of age, they're saying, but could be extrapolated from the safety profile in adults 18 to 55. Again, they didn't, it appears that, children were left out of the studies younger than that, so that's an unknown. I've heard Fauci say that as well. And that it says limitations of the risk assessment, follow-up duration, and pregnant women were excluded. So that's another important thing. I think there was a woman recently that went viral on Twitter because she was 35 weeks pregnant or something and got the vaccine, and everybody was in an uproar about it because there's not a lot of information about that. I also saw that there's possibility that they're concerned, for instance, that you could at some point have vaccine related enhanced disease. So here's that. This is the quote, they're calling it the Pharmacovigilance plan. Okay. So to monitor safety, basically. And it says important potential risks: vaccine associated enhanced disease, including vaccine associated enhanced respiratory disease. Also important missing information: use in pregnancy and lactation, use in pediatric individuals less than 16 years of age. And that FDA has requested that Pfizer BioNTech add anaphylactic reactions to the PVP as an important potential risk. So, and we've seen that. That's been in the news a couple times. So, what do you guys think about this? I'm just curious. I know there's probably a variety of thoughts. I'm going to just go back to the live stream here and see what people are saying. But I'm just curious. Let's see here. Health person immune system. So one of the things, obviously, William's bringing up in the chat is the immune system, your immune reaction and all that good stuff. And I do think that's, that is an important part of making a decision, right, about anything. Like when you're talking about, we started the live chat by saying risk versus reward. And I do think, that's an interesting point, right? That if you're looking at this and you want to, are you somebody who has a healthy immune system and we have seen people who had no underlying conditions that ended up hospitalized and died. So that does happen. But, for the most part, especially this virus appears to be one that affects older people, of course, with a higher mortality rate than younger people. Kids, it's actually, now that we're talking about it, I might as well just go back to my web here because I wish Dr. Fauci had said this because this, I think, would have probably been better. So kids' COVID cases on the rise, but most are mild, new data show. It says, while the proportion of COVID-19 cases in children has tripled or quadrupled since the start of the pandemic, it remains below their proportion of the U.S. population, and hospitalizations and deaths are uncommon, although racial minorities and those with public insurance and underlying conditions appear to be at higher risk for serious outcomes, according to 2 new studies. This is from the University of Minnesota, and this was from November 23rd, 2020. So, they talk a little bit about kids and transmission rate and disease rate and whatnot. And hang on one second, Lynn, if you don't mind. He is holding up a sign for me, but I want to finish this quick thought that I believe, gosh, I gotta look at here, that September 10th made up of only about 1.7% of total COVID-19 hospitalizations. This is children, with roughly 2% of infected children requiring hospitalization. Similarly, children accounted for 0.07% of total deaths, and their death rate was 0.01%. So, maybe, it would have been interesting if Fauci had said that too, about like, not just that, he vaccinated Santa and Santa's, immune system is there, you're good to go. But you could also like just tell kids that, the mortality rate is very low for kids, and that, and we don't have to just sell the vaccine as their only way out of this. That, just to talk facts here with the percentage and the risk factors and all that stuff compared to other diseases that these kids are exposed to on a regular basis. Are you going to talk at all about the disbursement of the vaccine based on... I don't know anything about that. Sorry. So Lynn has asked me a question. I do not know the answer, but maybe you guys have some questions I do have the answer to. So let's go back here to our streams. So I'm going to just check out some of our questions. We got any super chats here? Looks like, let's see, allergies and other issues like obesity can affect vaccine efficiency as well. Yes, I did see both of those. You can go back and read these reports. It did appear that there was data on obesity. I cannot remember specifically what it said, but it appeared to be consistent. Like there wasn't that wasn't one of the super adverse reaction risk categories that they were talking about. But allergies is something that we have seen countries like, England, for instance, like I've seen them come out talking about people, and like we've seen these health workers in Alaska. Now that said, I do believe that the healthcare workers in Alaska who were given treatment and hospitalized after the vaccine did not have prior history of allergic reactions. So, you don't have to have a prior history of allergic reactions to have one with this vaccine. And, something that a lot of people don't talk about is that you can have adverse reactions to vaccines. Oftentimes, and we know this because we have a child. And so, of course, it constantly comes up, and you talk to people about this, and doctors and whatnot, and even MDs, they're hesitant to just admit that, like I said, it's fine if you want to say that, hey, the risk of this is higher, and so the reward is greater than the risk for whatever your medical treatment is, no matter what that is, whether it's surgery or a vaccine or whatever you're talking about. But one thing that people just don't like talking about is that there is risk to vaccination. There is. And there is something called a vaccine injury court, and vaccine companies are not held liable. They're not sued, kind of like big tech, actually, for injuries. And so like the government basically pays out, the injuries when a kid, for instance, has a vax injury. And that's just fact. That's not anti-vaxxer. That's just fact. And I think, unfortunately, when it comes to the conversation about vaccines, there is some pretty severe skepticism out there, I think, in part because like some of this just honest risk that goes along with it is just not discussed by medical professionals. And it, maybe people would be more interested in having these conversations because you're seeing extreme skepticism around this particular vaccine. And maybe if they would just talk about these unknowns a little bit more openly, and it wasn't just like, oh, Santa Claus can come to town if we just vaccinate him and everything's going to be fine, which we know if Santa was reading the FDA reports that Santa would not tell you that. So I don't know why Fauci is telling you that. So let's see here. The conservative midwife. I'm not saying anybody is being dishonest. I just like to investigate it for myself. Let's see. Flu attacks. Oh God, I'm not going to talk about it. Flus attack your balls and directed microbes from cell towers. I feel like this chat's going to devolve quickly, but let's see here. Anything else we need to talk about? I think, I was going to bring up the this pass that the airlines are now going to be using. Not all of them, but some of them are going to be using this pass basically so you can prove your COVID status. So I'm interested if, where that's going to go, but I think I'm going to do a separate video on that. Let's see here. Well, everybody, I think I'm probably gonna, call it. I really, again, I just wanted to do this video because I just think we should be honest about what's known, with this vaccine. And of course, like they're saying that and you can read it for yourself, the subsets of people who, when they're calling it 95% effective or whatever, it varies depending on the groups that they looked at. But that would be, developing like severe disease after, getting it. So they're saying it's preventing you basically from developing the severe version of the disease. That said, like I showed you, there's a lot of unknowns about transmission. There's unknowns about pediatric patients. There's unknowns about mortality. There's unknowns about pregnant and nursing women. There's unknowns about immunocompromised people. There's unknowns about asymptomatic cases. There are still a lot of unknowns. And so again, like I just felt like a responsible, person who used to work in mainstream news where you're not necessarily seeing all these unknowns talked about, and you just see that, the whole thing about like it does feel like everybody, and hey, correct me if I'm wrong, whether this is a good or a bad thing, but it feels like the journalists, everybody wants this to work. Now, I'm not saying you should or shouldn't. I'm just saying if you're a journalist or you're a scientist or whatever, and you internally want something to be true, it does affect your ability to be self-critical and to be critical of the material. And so I'm not going to look at the scientists necessarily, because the science is not I'm not a former virologist, or a vaccinologist, or whatever you call them. I don't do, I've never, but I am a former journalist and, in mainstream news. And so if you have a group of journalists who they're on the rah-rah side, instead of like, okay, well, let's just make sure that we're aware of what's going on in these documents and we're honest with the public about not just the risks, but just the unknowns. I mean, I'm not trying to sit here saying like everybody, I don't know what's going to happen with this. It's a very new virus. So I don't, and neither do they. Like they're even saying that we don't know the long terms on this one. Obviously they don't know the long terms. This has been a very quickly produced vaccine. But just be honest about what's unknown and go from there. And I just get concerned when I see journalists all kind of like, I don't see them asking some of these questions. And so that's why I figured I'd just do this video and I present the source material to yourself so you can make the decisions for yourself about what you want to do. Let's see here. Jeff, you're still a journalist, not handcuffed by legacy producers. Well, thank you. I appreciate it. I do a lot more sort of like what Allison thinks on this channel than I used to, but yes, and my new producer lets me change my hair every once in a while. That's true. Yep, when she's drinking milk, I switch up the hairdo so that she's not paying attention and doesn't get mad at me. I thank you for the comment on the blouse. I'm not wearing my Flintstone outfit today. I just got this when I was Christmas shopping. It was on sale. And there's one other thing I wanted to talk about as it relates to this, but I'm forgetting. Anything else here? Okay. Oh, actually, this reminds me. So someone's talking about Parler in the comment section. So I may just use the end of this to just crowdsource a little bit because I'm curious, y'all. One thing that I want to start doing is, and I'm probably going to start doing is I'm going to chop up the live streams a little bit and upload shorter versions and then make the live streams available to supporters, whether that's on Patreon or somewhere else. The difficulty has been that some people don't want to do Patreon because understandably they have similar, community guidelines and content censorship as YouTube. And so I'm trying to figure out how to do that so that I can, because I think putting everything out on YouTube is probably bad business in the sense of like YouTube is so unpredictable with what it's going to allow me to put out there. And especially if I want to talk about topics like this. But the hard thing is like, it's, which platforms and how do you do it? And I don't know, maybe you guys know, cause you're on other platforms, what you think about like what other people are doing as far as putting some content out on YouTube for like the greater public, but then scaling back and a little bit on that, and then just putting unique content up for your supporters, for members, for people who do want to just be a part of the community and support, whether it's financially or just showing up regularly and producing more content for that, where it's in like a safer environment where it's not going to necessarily just get knocked off. I did see something about, let's see here, the vaccine will not be mandatory. So I heard, actually, I was watching Alan Dershowitz was on. He's a defense attorney, Alan Dershowitz, if you've heard of him. Probably you have. He's been on a lot of really big cases and actually been in some controversy himself. But he was on Viva Frey's, if you know him, attorney Viva Frey. His live stream, I believe it was last night. And I was watching him talk about it, about this particular issue. And he was saying he thinks that constitutionally the government could mandate the vaccine. He believes that, and he's pro COVID-19 vaccine, and he thinks that the government could. Now, he did say he would defend you as a defense attorney if you decided not to and you wanted to break the rules. But he did say that he believes if the government could prove a pandemic and sort of the greater good of the public health, that they could mandate a vaccine. My guess is more so that you're going to have a hard time doing things out in the public. Like, for instance, will your kids have to get the vaccine to go to public school? Will you have to be vaccinated to travel? So private companies could require you to have the vaccine, not just to work for them, but to be in their facilities. So one of the things that I've been looking into is this digital pass that you could potentially show people. You know what? Why not? I'll just show it to you right now. I already have it on the web, so I might as well just show you what this is, okay? And actually, what's interesting is I'll show you something else on Delta. But so this is world's airports and leading airlines join Common Trust Network and begin rollout of Common Pass in December in support of safer border reopening. When I first heard about Common Pass, I thought it was made up. I was like, is this really happening? But it is. And so this is basically what it is. I'll just read you the bullet points here. The World Economic Forum and the Commons Project Foundation welcome Airports Council International World as a member of the Common Trust Network. Common Trust Network airlines JetBlue, Lufthansa, Swiss International Airlines, United Airlines, Virgin Atlantic to begin rollout of Common Pass to passengers in December from New York, Boston, London, and Hong Kong. Common Pass lets individuals demonstrate their COVID status while protecting their data privacy. The Common Trust Network is a global nonprofit initiative to empower individuals with digital access to health information, including lab results and vaccination records. So I've seen pictures like in the sort of press releases of this where a person's like holding their cell phone and it says COVID-19 negative or like vaccination, I was vaccinated, and you show the airline that before you get on the plane. And so are you going to need something like that to travel in the future? Right now it's an option, but is that going to become mandatory? I don't know. It's definitely possible. And if you look at, this is Delta announcing its first COVID-tested flight departs Atlanta, charting path to global recovery. This is from December 15, 2020. Delta customers with essential travel needs can now fly from Atlanta to Amsterdam without having to quarantine after arrival, and with the knowledge that their fellow passengers and crew are COVID-19 negative after undergoing pre-flight testing protocols. Tuesday's COVID-tested flight with no quarantine after arrival is the first of two the global carrier is launching this week, with an Atlanta to Rome option starting December 19th. Delta is the first U.S. airline to offer COVID-free, quarantine-free flights between the U.S. and Europe, which allow customers to avoid quarantine after testing negative for the virus prior to travel and upon arrival in the Netherlands and Italy. Now, what I think is kind of weird about this, and again, maybe I've missed something, but basically it says that they have to obtain a PCR, like a negative PCR test. But I've seen people say that these tests are not 100%. And so can you say this if you're Delta? Can you say for sure that everybody on this flight didn't have COVID-19? They weren't just asymptomatic and testing negative. Maybe you all have seen Elon Musk tweeted once that he took 4 tests, and I don't know if it was this PCR test or something else, but he had 4 tests in a row, same hospital, like right at the same time, same nurse administering it, and he got, I think, 2 positive and 2 negative. So that's interesting to me too. So I don't know, but is that going to be something that airlines are going to be offering? And so if you decide not to get the vaccine, or you don't want to get tested, you don't want your health results on your cell phone, you don't enjoy Common Pass, are you going to only be able to fly like once a week on a COVID filled flight? Is they're going to like put you down in the bins with the suitcases or something like that if you refuse to do this? I don't know. I do foresee there to be some restrictions on travel, and I bet essential places of business like grocery stores they're still going to let people go to, but different businesses, recreationally, retail shops, stuff like that, dinner, going out to dinner. When we were in Nevada working on my husband's training program to put it online, we had our temperature taken when we went into the restaurant. Now, we could still have had SARS-CoV-2, right? We could have the virus and just be asymptomatic and no disease and just not have so it just because we had that done doesn't necessarily mean that we weren't able to transmit. Now, of course, we did what we were told to do in the restaurant, like, they keep you away from each other and whatnot, but just these temperature takings and the testing and all that stuff, is it a 100% guarantee? I don't think we're at that point yet. So I leave you with that. I'm probably going to leave you all to discuss this in the chat section, which it appears people are now, let's see, we're talking about EMF, 5G. I will tell you that YouTube does not let you talk about 5G related to COVID. That is in their policies. I don't have it ready to pull up, but maybe I'll do another video about it. Actually, I have a video in my library you could go back and look at about, getting censored about COVID. And I think I do run you through what COVID talking points YouTube will allow you to discuss, but 5G is not one of them. So let's see here. Who has admitted? Let's see. She flat irons her hair. Are we talking about my hair right now? Okay. I don't really have a whole lot of time to do my hair. Let's see. I brush it real fast. When you guys are watching that 5-minute beginning clip thing, I just run the brush through real fast. See right here. Okay. Let's see. COVID tests are 97% false positive. Look up the Highwire and Del Bigtree. I do. I know the Highwire. He got booted from YouTube. So see, that's what happens if you talk about this issue. And that may be a reason some people don't go after it, because he's got a pretty big team to keep him going if he gets booted off. But I don't. So, which is why I wanted to be clear again, and I will say it one more time. That YouTube, if you're watching this, YouTube manual reviewer, everything I've said has been read from the FDA briefing documents. I made none of this up. So just go talk to the FDA. Let's see. Trail less traveled. Wife, teenager, son, kindergarten daughter, myself have had worse colds. Yeah, I mean, some people, a lot of people, vast majority of people are, and obviously, part of the issue that was sold to us about all of the, whether it's the vaccination or the social distancing or lockdowns or whatever, is the overwhelming of the hospitals. And, look at LA, for instance, right now. LA looks like a mess. I mean, I have a friend there. I was just reading an article that like they're waiting hours to get people into the hospital because they've got so many cases right now. Interestingly enough, they also have some of the most severe restrictions on business lockdowns and whatnot. But, that was always the idea, was to prevent hospitals from getting to the point where they couldn't. And this one particular article said, too, that they had a woman come to the hospital and she was basically having a stroke. She was pre-stroke. Like, they could tell that she was going to have one, and she had this like blood clot or whatever in her brain. And they wanted to get her to a hospital with a neurosurgeon. And the closest one that could take her that had capacity was in Reno, I believe. So it can be a real problem. I'm not somebody, I don't think COVID is a hoax. Okay. I believe that COVID, is a real disease, is a real virus. SARS-CoV-2 is a real virus. And some people come down with COVID-19 that's severe enough that they either get hospitalized or they die. A friend of mine who is a photojournalist in Tampa, Florida, chronic mask wearer, social distancer, still got it. And he was sick, and he's okay, but he was sick for a while. And so I know it does affect people, but at the same time, I do think that when it comes to any virus, any disease that you could get, you got to be realistic with people about all the different variations in age groups and prior histories and pre-existing conditions. And, so, okay, let's see. That's not true. Hospitals are empty. It's not true that all hospitals are empty. There are some hospitals, like our hospital. I talked to our nurse back when this was beginning. Well, not even beginning. This would have been like May. So we were a few months in, and our nurses were getting furloughed because there wasn't enough business. And there were headlines that were like, hospitals are bleeding money in Washington in some areas. Because for exactly that reason. Now there are other hospitals that are. So it just depends. It depends on where you are and what's going on. And like in LA, these hospitals, I do believe, are having some issues. Now, and that doesn't necessarily just have to do with caseload, right? That could be because of rules about how many cases you can take, how many staff members you have to have available. So you may have enough, like a friend of mine was explaining this to me. It's not just beds, for instance. It's like all of the rules that the county itself or the state or the hospital itself has in relation to what is allowable at these particular places of healthcare. And, some hospitals may reach that threshold before others because they have different rules and there are different caseloads and whatnot. But anyway, it's just interesting because depending on where you are, of course, this has been argued before. Should you have, a varied approach to how you're dealing with this response? Anyway, I saw a video of somebody that was going around Twitter yesterday of somebody taking their mask off, picking up their dog's poop and putting it back on. Have you guys seen that video? It's pretty gross. Okay. Mask gave me a sinus infection. Arizona ICUs are at 97% capacity. We've stopped elective surgery again. Yeah, I believe that there are hospitals that are having a tough time right now. And that guy, I don't know if you guys remember that guy, Kyle. He was the doctor who was originally saying that the ventilators weren't working. I don't know if you remember him. I did a video about him and his kind of blowing the whistle about everybody using these ventilators and how ventilators, it appeared, were not working in the way that they had hoped to, and that maybe O2, like giving oxygen, because the question at the beginning was, is this really a respiratory disease or is this a blood disease? In other words, is it that you're incapable of getting enough oxygen in because you're having lung capacity issues or whatnot? or is it a blood binding hemoglobin issue? So your lungs are working, but the oxygen is not binding to the hemoglobin. And so your body's not able to carry oxygen through it. That was the big question. So if you put somebody like that on a ventilator, it wouldn't help them. And that guy, he's come out and said he's pro-vaccine. And if you had seen what he's seen with these patients, that you would never want this to happen again. And, I believe people like him. He was brave enough to come out and talk about what he was seeing that he felt like was wrong. So I believe him when he says that his hospital has seen some pretty bad stuff, and he's seen some pretty bad stuff. Whether you want to get the vaccine or not and you want to listen to him, that's your choice. But as far as like what he says about the problem of treating these cases, I believe that it can be severe for some people. Let's see. Take a shot every time someone types COVID. I would have already fallen out of my chair, passed out drunk. Okay. Hospitals get to capacity without COVID. I'm sure that does happen. Okay. I'd have to look. ICUs normally run above 85% capacity all the time pre-COVID. I have to look that one up. But I wouldn't be surprised. I don't know a ton about how hospitals operate. I'll be honest with you. Both of my parents are MDs, but I try not to interview them on my channel all the time because I don't want to be like Chris Cuomo. Was that a cheap shot? Let's see. So, let's see. What is? My God, the amount of Dunning-Kruger affected minds in this chat is sad. What does that mean? COVID makes people clot up. It's a clotting disease, nothing more. I don't know about that. Okay, let's see here. Okay. Well, I'm just scrolling through some more comments, see if there's anything else we need to talk about. We're talking about microwaves. All right. We're talking about London, LA is communist paradise. Let's see. 13 plus vaccines in development, from DNA-based to mRNA-based to protein-based to vector-based to oral. No long-term study nor study on mixing shots. That's a good point too about, getting one kind of vaccine versus the other vaccine, and what happens. I mean, look, at the end of the day, here's the point of the video, guys. All right. The point of the video is that this vaccine was made very quickly. Again, it was called Operation Warp Speed, right? That shouldn't surprise anyone. And there were doctors, I've seen them on television, talking about how we need to be careful about how fast this was pushed through, just because usually this kind of stuff goes through many, many more years of just follow-up studies, okay? So like 5 years or something versus 2 months. And I do think I have heard people bring up how interesting it is that like there are cancer treatments, for instance, that don't get to be pushed through this quickly. Treatments where people are like electively want to get them and they're like dying and they have no other hope except for this. And we have to wait years for these experimental treatments to go through. And so like, if we can do this with vaccines, why can't we do it with this? I think that's a fair criticism too. I've worked with doctors, for instance, that have been working on, like these immuno-boosting drugs basically for cancer patients, and how difficult it is for them to get approval by the FDA. And so if we can do it, why can't we do it more often with medicines that, people have no other hope? Aliens are here, baby. Jab faint. Let's see here. All right. Let's see. CV is essentially a first world disease. What's the flu count death numbers? Are it difficult to control influenza even with 90% contact tracing quarantine because of the presumed high level of pre-symptomatic or asymptomatic transmission? All right. Let's see. Keep on finding new ways to approve to suit themselves. Fuchsia, you got a sister? Is that my new name, Fuchsia? I don't. I only have 2 brothers. Sorry. Okay. Well, try executive order by Trump change that. Well, it just goes to show that it is possible in the United States of America to get stuff out there quickly, and that maybe that there's some options for people that are like legitimately like I said, cancer patients who like I had a friend who, and part of this problem is the health insurance issue. I had a friend whose mom had gotten her 3rd case of breast cancer, and she literally was on her deathbed. I remember driving my friend, she was a reporter I worked with, to the airport because she was going to fly home to see her mom in hospice and plan her funeral. And her mom was green lighted for this experimental treatment. It's like one of those, they often call them vaccines actually, but they're not really vaccines. They're basically take your own protein. Essentially, they boost your immune system, your own immune response to cancer, because cancer is your own cells, right? In a dysfunctional way. And so because she had exhausted everything else that insurance and like the FDA had allowed for, and she was going to die anyway, they were like, okay, you can try this. And she's still alive and she's cancer free. She was given like a week to live. I mean, my friend came back from hospice and she thought that was the last time she was ever going to see her mom. Why did she have to get to the point where she was suffering like that before she could try something that was going to help? I don't know. So that's just Tim Pool posted a video today. The CDC has recommended race badge of distribution for the vaccine for minorities first. Any thoughts? Okay, that must have been what my husband was talking about. He brought in a sign asking me about that. I have not seen that, so you know what? I'm going to have to go look that up, and maybe I'll do a separate video about it. I don't know. I could look it up right now if you guys just want to hang on. Let's just see. CDC race vaccine priority. To mitigate racial inequity, the CDC wants to vaccinate essential workers before the elderly. I'm just reading this from, well, that's Reason. Let's see who else did this. Daily Mail. Half of U.S. states want to prioritize Black and Hispanic people in vaccine rollout. COVID-19 is devastating for communities of color. Can vaccines counter racial inequity? Washington Post. Okay, here it is. How CDC is making COVID-19 vaccine recommendations. I think I'm going to have to probably read this because I don't think you guys want me to just sit here and read while you just stare at me on the screen. I don't know. Maybe you do. But I will definitely read up on this. And you know what? If you're interested in this, I'll put the link in the description so you can read it yourself. I don't know. That's interesting. Like I said, I'm looking at this. It looks like the CDC put this out. This was updated December 20th, I believe. So yeah. So I'll put this in the description. You want to read it. I'll take a look at Tim's video and see what that says. But I was not familiar with that starting the video. Okay. Well, all right. I think that's it, guys. I got race vaccine papers, please. How much money? Who follow? You can if they sign the form I posted. Check the comments on the video from 3 days ago. It's the most recent video aside from this one. Okay. You know what I will say is interesting, and I'm sure that this happens, okay, because there are other vaccines that have been green lighted for kids, but it's interesting how they're going to start the trials for kids. I heard Fauci say maybe in January or February. So who signs their kid up for that? I'm just curious. Are you going to, I don't know. I think I'm not signing my kid up for that. I'll say that for damn sure. I would be scared to death to put my kid in some kind of trial like that. Sorry. That's how I feel. Okay. Centers for Disease Creation. That's funny. Dr. Cowan, if you want the truth behind COVID, follow the money. That's what drives everything. You know, on that point, it's interesting because, like, obviously I don't disagree that money and power are huge motivators in the world. I will say that there is also, when it comes to, even say we're not even talking about this particular issue, we're talking about really anything where people think they're doing something good for another person. There's kind of this like morality heroism that I think infects people's brains sometimes and keeps them from being able to, and hey, people like myself, I'm not saying like I'm not you know, I'm not susceptible to something like that. We all are. But you have to be careful because, you know, the more that you think you're coming in and saving people from themselves, the easier it is to forget your blind spots as a journalist, I'm talking about journalists specifically. And so, like I said earlier, if you're just like cheering something on, are you seeing your blind spots? Are you seeing the places of the unknowns, the places where you need to just be sure people understand, hey, like don't get this medicine or this vaccine or whatever else it is and think these things are going to happen, because we just don't know. We don't know yet. So, these are the things we do know. These are things we don't know. Make the choice. And I think that's a responsible way to do it. Okay. What do they let super spreader events happen and tell everybody else to cancel Thanksgiving and Christmas? I mean, obviously, that's another point people have brought up about kind of the hypocrisy over who's allowed to be around each other and who's not. Are you allowed to protest, but are you allowed to protest, you're allowed to go out and celebrate, or you're allowed to celebrate an election or protest or whatever, but you're not allowed to do other things. Like, is there political motivation behind all of this? We've seen, I think, some of that hypocrisy around that. I've seen it on my own channel. I've talked about this before. I did a video about the Chaz Chop, which was that kind of multi-block takeover in Seattle over the summer and or spring, I guess, spring, summerish. God, it feels like years ago. The Chaz Chop, when the Chaz Chop was a headline, but that YouTube did not demonetize. But it did demonetize my video about the COVID-19 lockdown protests, which I just thought was weird. It said that was harmful behavior, but the Chaz Chop was not harmful behavior. So there is definitely politics behind a lot of this. Most of my family living on the reservation aren't taking the vaccine, especially the older relatives still don't trust the U.S. government. Shake right, that minority first thing is laughable. Look up exposure to microwaves on human body. You are going to wish it was 2020 again. Oh God, please no. Mainstream media has bastardized the science of epidemiology to the point that people will call scientists as tinfoils despite actual scientific studies. Chop rebuilding today over again, Chop 2. I need to go look and see what's happening with the Chop right now. Oh my goodness. All right, everybody. Let's see. I've probably overstayed my welcome on YouTube. What time is it? 1 o'clock. Hot damn. It's been about an hour. All right. Y'all know Megan, or this guy, Jerome, who's, if you're watching Jerome, I don't know. He sends me PayPals every once in a while, but he calls her Mabel in the stable. She needs to be, she needs to be worked as usual. Bob Wildfish. In another decade, will there be fertility or oncology issues resulting from this? And thank you for the generous super chat. I don't know. I don't know. We just do not know. There are just unknowns about this, and you should be aware that those unknowns exist. They're saying that in the studies, the certain things they know are, well, you can go read them. They're in my description. You can go read what they know and what they don't know. I'm not going to go through it all again. We spent like half an hour on that. But just be aware, like they're saying the unknowns are mortality, efficacy against mortality. If you're immunocompromised, pregnant lactating, kid, transmission, there's a lot of unknowns. So it's like if you're, being sold right now, that this is just a one and done, like you should know the drug companies themselves are saying that there are a lot of studies that still need to be done. They're saying that. And that shouldn't be breaking news, but unfortunately it's not, it's not talked about that often. So Loki, thank you for the super chat, for the generous super chat. I appreciate it, y'all. I do. We'll see if this video is taken down from YouTube. Who knows? Anyway, from my research, it takes the average vaccine 10 years to make through the process, starting from research to the regulatory approval stage, 120 months versus 9. Yeah, fact, right? It's just a fact. It's not, that shouldn't even be political. It shouldn't be political. Unfortunately, everything's politicized nowadays, but it's just a fact that it's usually longer. And this is not. This was fast. And so, what's I'm not going to go to one extreme or the other. I'm just going to sit in the middle right now. I'm not trying to ride a fence. I'm just saying, like, I'm going to wait and watch this. And there are a lot of unknowns. I'm going to tell you what the unknowns are. And then, if you decide, hey, right now there are too many unknowns, I'm going to wait and see, how they answer these questions a year or 2 years from now. And then maybe I'll get the vaccine. Fine. You should be able to say, I believe you should be able to say that. I believe you should be able to say that. And I know they're going to say, there we go, well, we got to have herd immunity or whatever. Listen, I'm sorry, but I'm pretty big on personal rights here. And so, man, if a government starts mandating some kind of medical thing, we'll see how my content changes on this channel. We'll see. I tend to be somebody who thinks you should be able to wait and watch and see what scientific research shows. I don't know why that's crazy. That should be science. Sperm counts in males are dropping off a cliff. I don't know that to be true, but guys, one thing I found as an environmental reporter, kind of interesting, a lot of people don't know about, is the estrogenic effects of a lot of your household products. So, for instance, soaps, okay? There are soaps, detergents, that are having estrogenic effects on fish. So one study that came out that got a lot of attention, I actually think I have a video on this on my channel that's still public, you can watch. Back when I was an environmental reporter, there was all this hoopla about how in Puget Sound, these fish were testing positive, salmon were testing positive for like Oxycontin and cocaine. And the scientists, though that was like a sexy headline, the scientists were willing to talk about it. And they were like, yeah, okay, this is happening. They told me that they were much more concerned about the estrogenic effects of these chemicals that were making it through wastewater treatment plants because of the male fish were producing egg yolk protein, okay? The male, like salmonids that they were studying were producing egg yolk protein because of this, which they believed was probably affecting their reproductive ability. If you're a dude and I'm just saying, okay? I know that was happening in fish. I know it was happening in fish. I interviewed the scientist. Yeah, cocaine fish, cool, right? Yeah, be careful what you eat. If that fish tasted really good, you might ask yourself, what was the side dish that I got with my salmon? Thank you for practicing journalistic integrity and ethics, holding off on stating your own research. Let's see here. Smoke it. What pronoun will we call transgender fish? Federal officers bull rushed and made a targeted arrest at the Antifa protest at the Portland ICE facility last night. Okay, I'm gonna have to look at that. Honestly, guys, I've been so all over the place with election stuff and whatnot, and like Section 230, I've not been keeping my Antifa beat going very well, which was what got me on YouTube. Talk about vaccine hesitancy, propaganda, censorship perpetuated by the mainstream media, aka former presidents getting a vaccine shot to increase compliance to the agenda. Do these fish live in Michigan? These were fish in Puget Sound in Western Washington. But you could look, because I have a feeling you may be having the same issues in Michigan. I mean, this is not like it's just a Puget Sound issue, I'm sure. People use these kinds of soap everywhere. And it's not just that. It's like, it's in a lot of stuff. I will say this, in the products that were having these like regular estrogenic effects on wildlife, I never came across something that is having a testosteronic, if that's how you say it. I never came across something that is having a testosteronic effect on wildlife. It was always estrogenic. I don't know why. I'm not saying that is across the board. I'm sure there's somebody watching who's a scientist to study this. You can correct me, but I never came across that. The effects that these household products, for instance, were having were always estrogenic. And, there were these sandfish, I think that was what they're called, that I was out on a boat with these researchers who I wanted to have on the channel for a while. Just have a hard time getting a hold of everybody in this new COVID world. But they were looking at these female fish who were like constantly, I guess the human version would be like they were constantly ovulating or something. They were constantly ripe for reproduction, whatever you call that stage of the female cycle. And they were like never getting out of it. They were just always in that stage of their reproductive cycle, or far more in that stage than going through the normal stages of the reproductive cycle, because again of these estrogenic compounds in the water. Haven't they also found sharks with antidepressants in the system? Yeah, there's antidepressants, cocaine, oxy. There's all kinds of stuff in the water. We could do a whole other live stream on this topic. This is something that I have covered a lot of. I would love for wastewater treatment plants to figure this out, because to me, that's the answer. Ultimately, you're probably not going to quickly change people's behavior and what products they buy, though I will say that we're now on like, natural essential oil soap and whatnot, and our detergent is Molly's Suds. If you're looking for a good, really just safe, you're like, I wouldn't want my dog to eat it, but say my dog got into it and ate a little bit of it, I wouldn't be rushing her to the emergency room. That kind of laundry detergent, Molly's Suds is my recommendation. It's awesome. Anyway, I've done so much on this, but I really wish wastewater treatment plants would get hip to this. I think part of it's funding, a huge part of it's funding. Our wastewater treatment plant in the Seattle area, this one particular that had all these issues, it was like just regularly releasing raw sewage into Puget Sound, or partially treated sewage, and it's just doing it because it's just old. It's just old, and it has and updating it hasn't been prioritized, and so that stuff's just going straight in. And then, obviously there's water that's coming from your sinks that's different from what's going through your toilet. And a lot of people think it's like, oh, well, people are flushing their drugs down the toilet. That's actually not really the majority of the problem. The majority of the problem is that it's still intact. This drug is still intact when you urinate, and then it goes through the water treatment plant, and it's not changed dramatically when it leaves. So you're putting your drugs in the water that way. The name for the fish that are always in the reproduction mode are the horny fish species. Nice. Okay. Okay, let's see here. They don't even test cell phones for safety and realistic. It says several mm from the body. Wastewater treatment plants can't remove waste from pharmaceutical plants. The making a makeup, cologne, etc. Exactly. They can't. That's why I wish that we could do something about that. Sodium fluoride in the water is the worst. I drink fluoride-free water. We actually drink spring water. If I could go straight to a mountain, y'all, and put a water jug under a babbling brook, natural artesian well spring kind of thing, I would do that every day. I love natural water. That's my favorite. Always producing eggs. Allison, you're a gem. Don't change. Okay. Thank you. Someone yelled at me, "You are responsible for others' health." I replied, "If I'm responsible for your health, I get to decide your diet and exercise." Estrogenic effects greatly influence testosterone. Probably so. Okay. Let's see. She hates it. Yeah, I don't know. I have a video about how I changed from going and having cavities at every dental appointment, and then now I haven't had one in 10 years. And my 3 big changes were, and like, I have no scientific proof, whatsoever that like this is exactly what made the difference. All I know is that this changed for me. And then I have not had a cavity, and I'm not promoting not going to the dentist. You can go to the dentist if you want to go to the dentist. I said this in the video. I hadn't been in a couple of years because I'd moved. I got really busy. Time flew and I just forgot. And so when I went, I'm like, oh God, I'm definitely going to have a cavity, because I used to go every 6 months and I still had cavities. And I didn't have them. And they couldn't believe that I not only didn't have cavities, but they were like, your gums are so healthy. What? But then some of them don't even want to hear what, when you start talking like me and you're like, oh, well, I take a cod liver oil and I eat fermented foods. And then they're just like, blah, 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 blah. And they're just like, my mouth's moving and they're not listening. But some people are interested in the health profession. So I try to tell them. But the 3 things I changed are that I started taking Green Pastures cod liver butter oil blend. It's high vitamin D, probably vitamin K too. And I take that pretty much daily. And I started eating fermented foods, so to help with my gut flora, like sauerkrauts, kefir, or however you say that word, but the cultured milk stuff. And I started using natural toothpaste. I don't use the fluoride toothpaste, and that's it. And I haven't had a cavity since. Okay, butter. Yeah, and I do eat a lot of butter. I like butter. Yeah, Jeff, thanks. Watch your previous video on the artesian well water. That's what I did a video on in Seattle. I missed that well so much. It's just north of Seattle, and you definitely did feel like you were in the tinfoil hat club, I'll be honest with you, like waiting in line there, but I didn't care, because it was, first off, you don't get anything free in Seattle. This was free. Technically, I guess it was in Linwood, so maybe that's why it was free. But but it just came straight out of the ground, and it was from like 400 feet deep. There's no concern over bacteria. Like if you're hiking, for instance, which we do a lot of, we use a filter, obviously, because you don't know what's in that. Like when you're just, a deer could poop in it and then you're drinking E. coli or whatever else. But this is coming from 400 feet deep. It's got natural minerals in it. Oh, it's the best water. I used to go fill up every week, and I miss that so much. And I'm trying to find one out where we live now, but haven't been able to successfully. So now we have a delivery truck that brings us spring water. It's not as fun as going and filling it up yourself, but I do think water. I know a physician who talks a lot about the differences in water. You think water is just H2O. That's a high quality H2O, but it's different depending on where you get it, and you have different stuff in it. And some would say the science argues that your body can use it more efficiently if it's purer, if it's from what's the most natural state, which would make sense. I mean, that's kind of the same with plants or animals that you consume. So it would make sense that water would be that way, and we're made up majority of water. So, and most people are dehydrated. I drink a ton of water. In fact, I could really use a glass of water right now. So I'm going to drink my water. My spring water. This is from my husband's recon battalion class. Yeah, thank you. I love Waterboy. That was a good movie. I also didn't go to the dentist for 15 years. Never had a single cavity. Went to the dentist about 6 months ago and got my first cavity a few weeks ago. Oh, I'm sorry. What do you think changed? My dad actually, who's an MD, he's a surgeon. He's the one who got me onto this cod liver oil because he started researching how to prevent having to get those not fillings. What's like the next thing? A root canal. And so he read up on cod liver oil and everything and started taking it. It's actually high vitamin D butter oil and cod liver oil blend from Green Pastures. That's the brand. But he never had to get his root canals. He was supposed to have several root canals, and he never ended up having to have them. His teeth actually repaired themselves. It's fascinating. Don't forget to dilute your peroxide or you'll burn your mouth. Yeah, I use hydrogen peroxide to clean, and I do dilute it with water. You can see that video on my channel as well. That was pre-Allison doing media analysis. So do you drink bottled water? Yes, I do. I don't just drink bottled water, but I do drink bottled water. Isotope variation. Okay, that's just a sciencey way, I guess, of saying that water's different depending. So do you watch Sticks and Hammer at all? No, I'll have to write that down. I'll remember it. I'll copy and paste it here. Teeth repair themselves, huh? All I'm saying is the dude, my dad, he never had to have his root canals that he was slated to have. And so, all right, well, gosh, I can't believe there's still a couple hundred of you that have been hanging on for this long. I'm shocked. What is everybody doing today? Is there nothing else going on? Why? You guys just like to watch me rant in my new purple shirt. Drank well my entire life here in Western Washington. I can't stand city water. I don't like city water now either. Now that we're on a well too here. And besides the fact that it's free, which is awesome, and Seattle water was extremely expensive, I do like the taste better. I can tell the difference now in water. Like when we have to travel and like say I have to fill up in the hotel sink, it's gross. Allison, it's raining. Yeah. I think it might be raining here too. I still got to go work Mabel in the stable though. Megan. Sticks. Okay. Processing thermal images. This is a much needed break. Okay. Well, glad for that. We're bored. Yeah, I know you have interesting live streams. I believe you guys are probably bored, but it's okay. It's okay. Hey, I don't have anything else to do, right? It's not like I have a 8-month-old. My husband just got home from a week of training law enforcement in Missouri, and I got 2 horses that don't behave that need to go run around, and I got to clean the house, and then I got to research all the conspiracies that are out there and figure out what's true and what's not, and then figure out how to build a business online and not be taken off by YouTube and all that good stuff. So I don't have anything else going on either. What's up for Christmas? We're going to be here for Christmas. I believe I finished. I can't tell you what I got my husband because I think he might be watching. But I will give a secret tip. It does have something to do with the Airstream that we're renovating. So you guys can guess on that one. And I'll show you next Sunday. Got to make some cookies. Yeah. Well, I bought a pie to bake. It's like, so I can feel like I made a pie, but not. So I'm going to put it in the oven. I'm gaming. Rather watch, listen to you than work. Yeah, I hear you. Outdoor shooting range in Missouri has been on news. I'll have to look that up. Star Wars moving stars background. I am working on and changing my background, everybody, just so you know. I just haven't gotten there yet. I am going to put some stuff up in the background. I know it's probably boring watching the white wall, but willing to give up $140K a year job, not taking the vax. I will say this. I believe that this disease, well, this virus, I should say, because not everybody gets the disease, right? There's a difference. You get the virus, but not get the disease. A lot of people don't get the disease. I believe these are going to bring us to some kind of event. I don't know what that looks like. I don't know, and I guess I shouldn't even say event in the sense of like it's a physical event, like a one-time thing, but I think it brings us to some kind of Supreme Court decision or states drawing lines on one or another policy. It's going to push some kind of something is going to arise from this. I believe that because there are just so many people who do not want to be mandated regarding whether it's lockdowns, vaccines. People are starting to get wary of this. They have been for a long time. And I don't think that this is just going to go away, for instance. Like I think when you're watching a lot of the coverage in sort of the, especially like when I watch like the national TV coverage, there's kind of this, oh, we're just going to go back to normal. We're just going to go back to normal. And I can't wait and whatever. And they're just, I think sociopolitically, there's going to be something on the horizon that happens. Like I said, maybe it's just a bunch of lawsuits and get determined by the Supreme Court. I don't know. Alan Dershowitz said last night on Viva Phrase that he thinks the Supreme Court could rule in favor of the Constitution, enforce essentially that it's constitutional to enforce or mandate a vaccine. We'll see. But either way, I think if that happens, there's going to be a reaction to that. So I'm interested to watch. I'm here on the YouTube for as long as they'll let me be on and talk about it. Let's see. If they force the vaccine on me, I will force me on them, and they do not want that. There are a lot of people who feel that the same way. Well, good thing Biden was elected then. The range was on news over noise complaints. It was private. Now it's cop-owned. 10 hours of chores, build a kitchen, free 2 kids, no money, stuck in big smelly city. Just want to go for a whole day runs. Thanks for that's a great discussion. You're welcome. What do you think about filtering your shower water with a filter? Okay. Thank you for also bringing that up. We do have that. We have not hooked it up yet at our new place. I do want to do that. It's one of those like charcoal filters. Or does it use sodium chloride or something like that? It's like either salt or charcoal. I can't remember. Don't hate me. But we do have, it's really big. It would be, I'm 5'3" and it would be almost as tall as me. It's a big filter and you hook it up to your main plumbing and then it softens your water and it takes out a lot of the chemicals, but we're in a well now, so we don't really need that as much. The last 2 places we've been on have been in a well. So, let's see. But yeah, I do think like even showering and whatnot, I think about that stuff with water. Whole house water filtration is worthwhile. Yep, totally. Some school systems mandate vaccines. Washington does. Yep. And if I'm correct, some of the vaccines that are mandated do not prevent transmission. Perhaps that's why they're like, okay, everybody get the vaccine. I'm guessing, but just because you're vaccinated, that's not necessarily unique to the unknowns for the COVID vaccine, whether it's that's a big question that's asked. I've seen asked about other vaccines. That's something that is commonly asked, not unique to COVID. Like, is this going to prevent transmission? Steven, thanks for the super chat. I really appreciate it. We have naturally soft water, very unusual for the Midwest. Filter on the shower head. Filter on the shower head. I don't know. Might work. I don't know. Like I said, the only filter we have is, I would assume that would work. Another story I did a long time ago was about nitrogen in the water due to, well, it's very controversial. So, but I'll just say that a bunch of dairies, a cluster of dairies, were sued in Washington over nitrogen in the groundwater and nitrates. And so one of the things that people did were, that was a story I covered, and one of the things that people were doing were these reverse osmosis machines. And so those are hooked up like your sink, for instance. You can just hook it like to your sink specifically. So maybe you have something like that with your shower. I would assume that would work. Like, just put it on your shower head. Food shortage coming. So I have a video about food shortages that I did back when they were euthanizing all these animals because they couldn't make it through the processing plants fast enough because the processing plants had to shut down because of COVID. And though I did see grocery stores like, hey, only 1 pack of pork per person or family or whatever, I did see that. I don't think that it wasn't like, I don't think people at my grocery stores anyway, okay, I will say that, that you could get something else instead, or like you could get at least 1 or something like that. But they your favorite brand might be missing or they're out of stock for a while. That said, in other parts of the world, this has been a very serious issue. In America, we're lucky right now. But I believe there are like, and I'm just going to look that up, honestly, because I might as well. Why not? No one's in a rush anymore, right? If you're still here, you're still here. You're in it to win it. So, famine, COVID. Yeah, so this is October 14th, 2020. Are warnings of a COVID-19 famine in Africa overblown? Okay, we must be cautious in using hyperbolic language. So it says, well, a joint report in July by the World Food Program and the Food and Agriculture Organization. Here, I'll just move this over. Okay. Said that they calculated COVID-19 could create, I don't know what ended up happening, an additional 121 million hungry people globally by the end of the year, mostly in 15 already crisis-affected African countries. But as an increasing number of African countries ease their punishing lockdowns, ending restrictions on international travel or internal travel, relaxing curfews, and reopening schools, do these dire warnings still hold true? So then this person in Nairobi says, I'm not convinced by the numbers. There have been alarming predictions, 6,000 to 12,000 daily deaths from hunger, projections in April, biblical proportions. So, but in these places, as they're saying, like, it's famine is an issue. You don't need COVID to exacerbate, right? So anyway, so yeah, but there are all these collateral issues with COVID that I think, don't necessarily always get the attention that they deserve. So, and that seems to be one of them. So, okay, there will not be enough food to feed the world population. That is why there's a depopulation agenda via the vaccine. So I will say that I hear people talk about that. And that's often a reason that people will push like mass factory farms, for instance. But something that you'll hear people on the other side of the argument, like, again, I've cited Joel Salatin a lot. He's a very well-known farmer in the Shenandoah Valley. And he talks about how, like, the vast majority of farms across the world are peasant like he calls them peasant farms, in the sense that they're if I became a farmer, I would consider myself like I'm a peasant farmer, in the sense that it's just me. Like, I'm not a corporate farmer, okay? And that the vast majority of farms that feed people are local farms. That's what he says. I don't know. I'd have to go back and do more of a research. But the argument is that, like, actually we need more farmers in areas, and this is something that I think most people in the agricultural world would agree with, is that we need more farmers in different areas. And we don't, the more we have like bigger centralized facilities and farms, the more we see problems like we did with the initial COVID shutdowns of these facilities, because there's these juggernauts in a few places, instead of like, okay, well, my local processing plant or my local farmer, I didn't have any of those issues because we bought direct from our local farmers, and they process all their own meats. So it wasn't an issue. And I didn't have any problems feeding my family, with like their product, because they didn't have the same issues that like these mass slaughterhouses or mass corporate farms have. And so from a food security issue, whether it's COVID or not, there's definitely a conversation about not that there isn't enough food, but how it's distributed food waste is a huge problem. I think we throw out close to half of the food that's grown in the United States. We throw it out. Grocery stores get rid of enormous. I think it's called what was that? There was a documentary on Netflix not too long ago about food waste. It was pretty gross. Grocery stores throw out a ton of food. So there is a lot of food out there. It's just not distributed well. And that's one of the problems. And then more and more, it's harder to become a farmer. It's very expensive to be a farmer. And unfortunately, there's not a lot of public interest right now in prioritizing that world. A lot of people still just, they just go to the grocery store and the food just shows up, and people don't necessarily make the effort to get to know who's growing their food or raising their animals, and they don't know the issues. I mean, it took me years to understand really the problems that farmers are facing. And the average American farmer is 65 years old and getting older, and the younger generations are selling farmland for development, for instance, because it's too expensive. And if you're a brand new farmer, say you're somebody who wants to get into farming, to scale up, to buy like a combine, for instance, these are $250,000 or more pieces of equipment. So you're like, the decision is like, am I just going to go into debt forever, or am I going to become a subcontractor for a company like Purdue, for instance, and then deal with all the stuff that goes along with that? So there's a lot of issue there. The only issue is the shortage of imagination, or the real shortage is the shortage of imagination. I think, hey, got a holidays coming up. If you're cooking a meal, maybe go get to know somebody who's growing animals and food around and ask them if you can buy from them direct, and then start doing that more and more. Joel Salatin is a true hero. I agree. He really is. He's one of my heroes. And I'm glad that he's able to talk to the mainstream audience the way that he is. Let's see here. Yeah, living in a small, I'm trying to see what we got. One person talking about milk gets dumped to keep the price up. Dairy farmers they are having a hard time right now. They're having a really hard time. Same here. Small farmers kept locals here in food. Let's see. Living in a small farming community has a lot of benefits. I buy most of my food from local farmers. It's cheaper, better, and keeps your money in the community. I will say, like, people ask about buying, I get a lot of people asking me about how I buy my food and it's too expensive. Well, yeah, it's more expensive to go to Whole Foods than it is to go to Safeway. Fact. All right. I don't have to prove that one to you guys. Well, a whole paycheck. All right. But where it's cheaper is if you say buy a quarter cow or buy a half lamb or whatever. That's what we do. We actually just got a half lamb, actually, from folks who live a half an hour from us, who found me on my YouTube channel, and they just happened to live near us. And so we just had a half lamb delivered. We got a quarter cow that we still have some of in our freezer from last year. Great farming community in Central Washington, where we used to live. Now we're in Eastern Washington, but those ranchers were awesome. Got to meet their family. They're great. I think they still follow me here too on YouTube. And then also the guy who raises the beef and the pork we get. And also, I still get fish from the same guy that I got salmon from in Seattle. He's an Alaska fisherman. And the guy who I buy meat from, who goes to the Seattle Farmers Market every week, God bless him, he drives 6 hours each direction once a week, sorry. But, well, yeah, each direction once a week. And he brings me the fish back from the fisherman. So I have my whole system set up. I don't buy animal products really from a grocery store ever anymore. It's harder. Plant products are harder out here because in Seattle, it was like a bread basket in the Seattle area that you could grow vegetables all year long. But out here, it's harder. So you have to they end up getting, imported from somewhere. Cow pooling is a win. You raise half lambs. Do they drag their back legs? The lambs are not half lambs until they just have one bad day, where then all of a sudden they're only a half lamb. And that's how I like to buy my meat. As they say, one bad day. I know. I love how the viewers haven't bottomed past 200. Seriously, I'm shocked, you guys. I really am. I'm shocked that we're still talking here. At some point, I gotta go have to check my beehive. Okay. Yes, thank you. Thank you. I gotta go check my horses. Our local egg farm producer was a better price than big chain store during the food shortage. Yep. And I actually just talked to ranchers who were like, they saw a lot of business during COVID, local ranchers, and I hope that keeps up. I'm not a vegetarian. No. What is your take on Julian Assange and Snowden possibly being pardoned? I think they should be. I think Assange was a publisher, and I think if that guy spends the rest of his life in jail, and the New York Times or whoever else doesn't ever report on it, I think it's an absolute travesty of journalism, because I don't understand how they don't see they're going to just come for them next, or they can, just opens a door for that. Snowden reported, I mean, I know some people call Snowden a traitor. I don't. The program that Snowden leaked the files on was found to be an illegal program. So I do think Snowden should be pardoned. So sorry if that makes me too controversial, but friends of mine that are farmers have a saying, the only time a farmer makes a profit is when they retire and sell their equipment. Yeah, it's kind of sad. I mean, farmers are like the most dedicated people. I don't know how. And not, I mean, of course, there's bad farmers and good farmers, right? Like, just like any industry, there's good journalists and bad journalists. There's good doctors and bad doctors. But I got to say, they're some of the hardest working people I've ever met. And the ones who are trying to responsibly feed their communities are just amazing people. And I am so glad that I fear losing them, frankly, more than even, I mean, I have two doctors for parents, right? I've said that before. I love doctors, but my medicine is really my food first and foremost. And so I see them as, just as important as healthcare workers. And unfortunately, whether it's issues that they deal with like, commodity regulation and whatnot, or just Americans being willing to pay the value of their food, the research I've read, that shows what we used to pay money for in like the 50s, for instance. I think we were paying like 50% of our income, our household income, on food. And now it's down to like, 15% is on food. Now we have cell phones and TVs and all kinds of cable options and whatever. And so now we spend all our money on that. But I didn't have cable for a long time. And actually we don't. Who am I fooling? We don't have it now. We just watch like Hulu or whatever. So like, I was funny. That's one of the reasons I got out of mainstream news. I was like, I'm not even watching this stuff anymore. Why am I making it? I think I saw my brother say Allie for president. No way. I'm never running for president. I don't want that job. The dairy mafia. I can do it. LOL. Many dentists use harsh products. Scratch the enamel and gums. Buy local and pay cash. Yeah, I agree. County fairs were a good place to stock up on fresh meat. All right, let's see. And Lynn's back in here. Jeff Fidley. Comment got censored. If it's electronic, there is no spoon. Okay, Lynn just told me that Jeff got censored on YouTube for the chat for saying that. What was it again? I can hear myself, by the way. This is what Lynn just handed me. I don't know what this means. What does this mean? Somebody help me with that. That's how high tech we are in this family. We just bring in whiteboards. Okay, Project Veritas reported 4 days ago that Julian Assange asked Clinton's State Department for help mitigating damage of unintentional 2011 data dump. It was a former employee that dumped the files. Well, I do think, that Matrix reference, PV. Lynn, is that a Matrix reference? I don't know. I think Assange, it's interesting because he's drawn the ire of both political parties. So, I do think if he hadn't been involved in the stuff with the 2016 election leaks, and the Clinton emails, that maybe you'd see more people on the left wanting to call for his release. But I think he's been kind of become an anathema to both sides. Well, Why doesn't CDC contact tracing include state-to-state transmissions? This would promote transmission from hotspots. I don't know. Do you guys get that thing on your phone where you can find out if you were... Do you get that alert on your phone? Like, sign up to be alerted? Did you do that? Our trailer is just hanging there, holding cardboard box garbage from Amazon. I feel your pain. Our Airstream, you know, Lynn may have some time in the next couple of months to really start going after the Airstream. I hope he does. Because I sure would like to finally buy property and move into it. Okay, yeah, people are saying, no, you're not going to do it on your phone. I have friends that if you're relying on electronic files to prove C19 only as good as the trust you're willing to put in that system. I just saw Jeff write another comment. Is that after? All of ask her profit. Okay. I searched the questions on Google. They don't ask that I have seen. Okay, guys, I'm going to run, but I want to say one thing, okay? Probably none of you guys are going to want to go back and rewatch this because you lived it in real time. But I'm probably going to start making the streams private for only like release in certain places and then clipping parts of them so they're like 10 minutes long when we're just talking, or maybe 15 minutes long, and then uploading those clips. I'm sure you've seen other YouTubers do this. So if you no, if you go back and it's like it's private, I promise you I will put a link for how you can access the full stream wherever I decide to put it. And then you can decide whether you want to do that. And then otherwise, it's just going to be the short clip. No, like Tim Pool. Is that what Tim Pool does? I don't know. I don't see him having like these long live streams that are still there. Way too many New Age crystal people here. Yeah, I've seen like some people do it that way. And I think that, yeah, well, Viva Frey, I believe he puts his whole stream on there. But then he also does clips. He does highlights. I'm talking about, what do I do with the whole thing? Do I just, because I made it private once because it's so long that what happens is people that don't want to watch the whole thing, they dump out early on. It hurts the analytics of the video. And also think like the people who have tuned into the live stream and are supporters of the channel, I feel like there should be content for people who are like regularly supporting the channel. And so I'm thinking like, do I make the full live streams available to them? I don't know. I'm just debating here because I'm trying to figure out what my next business move is. Tim Pool has long live streams and cuts it into individual videos. So, okay, let me ask you this. When you go back, say you got an alert that Tim had a live stream and you click on that alert, and does it go to and say this video is now private? What does it say when you click on the original alert you got? Because what ended up happening with my last one when I did this, people clicked on the alert and then they got to the live stream link and it just said this video is private, and I got beaucoup emails and questions about this. It was very confusing to people. Tim Pool does both long and clips. Yeah, so can you go back and watch the entire IRL? Too much is always better than not enough. Make chat members only. That's an option. I'll be honest with you. I just get frustrated giving YouTube more money. Like, no offense. YouTube, I'm happy for what I've been able to do on YouTube, but YouTube takes 30% of super chats. 30%. It's a lot of money. So, and then like they may take this money, all right, and then they may just, I don't know if they're going to do this, but this topic is a little edgy for YouTube, and so they could just clip it, and it just doesn't it ceases to exist. But they're still going to keep the money from it. Okay, it just bothers me that can happen, and so I'm not going to give up on YouTube. I'm still going to be on YouTube because YouTube is it's a wide net. I can still cast it to a lot of people, but it shouldn't be my main. It shouldn't just be like my main, meat and potatoes for like this as a business. If Allison Morrow is going to ever do this full time, where like this is a regular thing where I can come on, every day and talk about stuff, I got to have a business model that is not relying on a landlord that could kick me out of the brick and mortar facility. You know what I mean? I'm on Patreon, but some people don't like to do Patreon because they have community guideline stuff. Parlor, can I do Parlor and then make stuff private? Like, can you become a member on Parlor? And then somebody tell me. Okay. You can learn. Yeah, 30%. Live streams aren't private. Okay. Yeah, I usually put it on audio afterwards. Okay, that's not a bad idea. Maybe I'll make it fully available. Anyway, I'm just trying to figure out what to do with people who are regular supporting. I'm not on Rumble or Parler. I'm gonna probably go to all these sites very soon. I am on Locals. There's a link in the description. There's a link in the description. I forgot to say at the beginning of the video. There is a link in the description for my PayPal. There's a link in the description for my Patreon. If you don't want to do a super chat and give YouTube more money, you can go to some of those. And I am gonna do I am going to get on to the other ones just to diversify. But I have found that when I've done the research, and I had a friend of mine who makes websites, she said it's basically impossible to just have my website as the hosting platform. So I'm always going to be using a hosting platform. Just trying to figure out, pick your poison on this. I only know how to be broke. I feel your pain. I do. Okay. Switch to brand new tube. Try UMaker. This is partnered with Epoch Times. You have to go to all sites. Switch to library. Yes, there's just Rockfin. I've heard some people on Rockfin. There's just so many options out there. I'll tell you guys, it's hard. It's hard to be a content creator and a business person at the same time. Trying to get all this stuff out there and make sure that I'm on the different sites and blah, blah, blah. Don't do Parler, which is pronounced parlay. Oh my God. I can't get into it again about parlay or Parler. You guys know I have anxiety about grow dope. I was just talking to a friend of mine actually who grows dope. She just moved from Washington to Oklahoma. Save all your content and release it once you change platforms. What would be the criteria to get into the private area? I don't know. I think different places have different options. Like you can, like in Patreon, you can do like $1 Patreon and become a patron. I don't know if you guys know Tim Dillon, comedian Tim Dillon. I think that guy is one of the funniest people on the face of this earth. I'm a $5 patron of Tim Dillon. So like every month I pay $5. And he does a weekly live stream, or I know it's not live. It's an upload, like a show, an hour-long show just for patrons. So I want to be able to do not just content only for supporters, but some content that's just for supporters. Because I feel like it's fair for people who are willing to pay extra money to get some extra content. I feel like that's the American way, no? so I feel like it should be, you should get something if you pay for it. And yeah, Tim Dillon's awesome. Yeah, I'm on Locals, so go to Locals. I do, but I only have like 11 followers on Locals, so it's not really something that's going to be sustainable if it stays that way. If you're a Patreon supporter, just stay there. I don't think you have to worry about that until versus Locals. I mean, you could go to Locals if you wanted to, but right now I don't have Locals set up with enough people for there to be a way to find. I don't think anyway. I don't think I have enough people yet for you to support me financially on Locals. If you're already on Patreon, just stay on Patreon. If I ever feel like Patreon's going to kick me off, I'll let you know. but thank you for bringing that up, because I do feel like the people on Patreon, for instance, or other places, I want to give you guys some extra content because I think you deserve it. So that's why. Tim Dillon, Alex Jones on the Joe Rogan Show were too funny. Yeah, that was an amazing, amazing podcast. Many creators promise X times a week or content, but they're always later behind for months. That's when I defund. And that's your right to do so. Yeah, don't like the weekly, monthly. Would do once a year, though. I'm on Locals. You'll have 12 in a few minutes. Okay, thanks. I'm on Facebook, yeah. Tim Dillon on Alex's show was better. I have to go look at that. I have not seen that yet. But I bet that was pretty awesome too. Okay. All right. I hear my kiddo crying, so I'm going to go do the mom thing and take care of her. And I hope you guys have a great rest of your Sunday. I will see you before Christmas, but if you don't catch any of my videos, Merry Christmas. And we're going to roll into 2021. Somebody said, I'm going to wish it was 2020. I really hope that's not the case. I'm going to try to think positively. Go back and watch the beginning of the live stream if you missed it and you're interested in what the FDA reports show we don't know about the vaccines. Like, share, subscribe. You probably already subscribed or you wouldn't be here. And guys, what do we always say? I'll see you next time. Have a great Sunday. Bye.